So I think it is worth mentioning that ibrutinib is actually approved
Right.
in this indication. It was the first and the only drug
Yeah.
approved in chronic graft versus host disease. It was a small study. It was a 42-person study with fairly narrow entry criteria, but there are updated results available from that trial that were published not long ago by Waller as the first author. And the response rate was nearly 70%. Again, these were probably patients without advanced, very burnt out chronic graft versus host disease. I think that has to be said. But it's hard to argue with a response rate of 69%. And so ibrutinib, do either of you have any experience using it in chronic graft versus host disease?
Yeah. Well, so, no, I do. I think that there is there's a difference in everyday or, out of clinical trial experience with what the clinical trial shows, because I think that the general trend is to leave ibrutinib for, way too late in the game when patients are not responding to anything, to be fair, right? So I think that ibrutinib gets undeservedly criticized, and not because of lack of efficacy, as it was shown in the clinical trial, which, although small, was a good clinical trial. But it's the fact that the patient has, as you said, Corey, a burned out chronic graft versus host disease that is likely not to respond to anything. And I think that one good thing to look at and to follow from the ibrutinib study is that is the kind of selection that we should do in our clinical practice. We should not wait until, you get to the point of a situation in chronic GVHD where treatment doesn't do anything because all the manifestations are irreversible. But we should give the opportunity, the patient, the opportunity of these treatments earlier on. And I think that's the kind of population that you had in the ibrutinib study, which is a good thing to get from the study.
So there also is experience with ruxolitinib, and Usama alluded before to retrospective studies that looked at the activity of Rux in acute GVHD, and those retrospective reports did suggest that it is active in chronic GVHD, and we are all eagerly waiting the results of the REACH-3 trial. So we've talked about REACH-1 and REACH-2, but REACH-3 is a randomized trial looking at ruxolitinib in steroid-refractory chronic GVHD. There aren't any results or early top-line results available, so we don't need to discuss or dwell on that. There are certainly a number of other clinical trial agents that are promising out there. We've been actively involved with the KD025 or the ROCK2 inhibitor, which appears to be a promising agent, but again, this is a drug that is still in development.